He kōna I purangi tēnei nā te reo irirangi o Aotearoa.
This is Media Watch. I'm Colin Peacock. This week, the Media Minister gets a blast of extra scrutiny in Parliament.
So media outlets can perform better with less funding, is what you're suggesting?
Well, I think you'll find that there's people doing that every day.
And a certain market-leading online marketplace gets a rather soft-focused treatment from a news show made by a company it happens to have invested in recently. But this week we focused first on health in the news. Debate has been raging over whether private or public providers should be the key to cutting waiting lists for surgery, or what kind of combination of both would work. But all of a sudden, our sick leave entitlement surged to the top of the news agenda, sparked by an unlikely source.
I make no apology for using the public and private system to get people the hip, knees, cataract operations that they need. And I, go and tell that to the people waiting that we shouldn't be doing that. I take no apology for the work that we're doing to get as many people the treatment they need done in a timely, quality manner.
That was the Health Minister Simeon Brown in an RNZ News bulletin last Tuesday afternoon about some good news in the latest quarterly updates. More immunised children, more cancer sufferers treated more quickly, and fewer people waiting for a long time in emergency departments. But there was a but coming.
But the percentage of patients waiting longer than 4 months for electives and specialist assessments has increased.
But the government has a plan for that too, as the Minister said, involving private hospitals doing more operations, as he told News Talk ZB last Sunday.
Because we haven't been ideological about it, we've been focusing on pragmatic solutions, getting patients seen in a timely manner by maximising what's being able to be delivered both in the public and private system, which is what's good for patients.
Now, last weekend, Simeon Brown also unveiled law changes that will bring back the national health targets scrapped by the previous government, and he was pushing hard the message that outsourcing of low-complexity operations to private hospitals was great news for those on waiting lists. But that was soured slightly when Herald political editor Thomas Coughlan reported the next day, on Monday, an official paper about the costs of that, released to him under the Official Information Act, and another one that was released to the Labour Party, which showed that Treasury reckoned greater cuts to health will be needed to meet the government's demands. But even though all that was in the Herald on Monday morning, it didn't come up when the Prime Minister appeared on the Herald's stablemate station News Talk ZB for his regular Monday morning chat with the host Mike Hosking.
If you look at what Simeon's done on healthcare, we're really cranking in to say we want outcomes and results, and we're going to lead you into that space.
Well, that was the other thing.
The Prime Minister went on to repeat what his Health Minister had said, that no one cares where they get their operation when they're staring at the hospital room ceiling about to get it at last. And Mike Hosking said he couldn't agree more. And then he told the Prime Minister about an interview he'd done a few days earlier with a Christchurch surgeon who works in both the public and the private system.
I think it is the future. I think it's a lot more efficient. You can do a lot more work. The rules on hours are not there with the unions. It's just so much more efficient. But we just need to build a model where we can train our younger surgeons, younger anaesthetists, so they know how to do the simple cases as well as the complex, hard cases.
And surgeon Chris Wakeham told Mike Hosking one major advantage of the private system was this.
We need to be more flexible in public about hours. At public, at 4 o'clock, they start wandering around and saying, when will you be finished now? Will you be closed in half an hour? They even come around at 1 o'clock and say, it looks like you'll finish after 4:30, so we won't let you do your second case.
Right.
So that has to wait a week until the next, which is just so inefficient. You wouldn't close your factory at 4 o'clock if you still had work to do.
Couldn't agree more.
So, when he chatted to the Prime Minister last Monday on ZB, Mike Hosking, who couldn't agree more, put that apparent shortcoming of the public system to Christopher Luxon.
Private system, public system, we pay for it anyway.
Imagine how many more you could do if the public health system didn't start wrapping up at 4 o'clock.
Well, that may be true, so I'm sure if that's true, we'll find out about it.
And after that, Mike Hosking went on to tell his listeners,
now that was a revelation to me. It seems the weirdest thing in the world, so it does deserve some sort of answer, so we are on it, as they say.
And later, Mike Hosking read out a text from an unnamed listener blaming medical professionals for slowing down the public hospitals.
Surgeons do their rounds first thing in the morning in order to be ready to operate by 8 at the latest. It is the nurses and anaesthetic technicians who insist operating stops early if it looks like it's going to go past 4. Some staff have worked out that if they slow things down during the turnaround time between cases, then they can have the last patient put off and the list shut down after 3 o'clock. I would like to think that isn't true, but we'll get to the bottom of it eventually. The other thing is...
If Mike Hosking thinks a random anonymous claim by text might not be true, probably best not to read it out to the biggest talk radio audience in the country before he finds out if it is true or not. But he said he was on the case, so did he find out the truth for his listeners? We'll come back to that. But having put the Prime Minister on the spot about that, he then hit him with this.
Other thing was my tech guy was round at my house on Friday fixing some stuff.
Saying, restart, Mike.
And
Blue screen of death, was it?
And he said to me, why do we still have 10 days sick leave? And I thought, that's quite a good question.
Yeah.
Why do we have 10 days sick leave?
Yeah, well, there's some changes coming through on workplace relations, which Brooke is leading through.
So we had
Now, Mike's tech guy for hire got a headline-making response on that from the nation's leader.
So we had 5 sick days until Jacinda decided we needed 10.
Correct.
For COVID. COVID's now, can we agree that it's gone?
Yes, it's
and
just
therefore we
normal
might need to
practice.
do something about sick leave.
We might need to. We might need to do things about pro-ratering sick leave as well, because people who are on part-time contracts are getting full-time 10-day equivalency. So Brooke Van Velden's working through some of those issues.
When are we getting an announcement on that?
The pro-ratering of sick leave for part-timers had already been flagged in June last year, as it happens, as part of Brooke Van Velden's reforms as Workplace Relations Minister. But the Prime Minister made it sound like cutting full-timers' allocation might be in the mix too last Monday.
You do this to me every frickin' week.
I'm sorry to hold you to account. My sincere apologies. I just thought you were running the place.
No, there will be. I just can't remember the date off the top of my head.
So an announcement
but I know we've
on
discussed
sick leave is coming from Brooke Van Velden.
There was a whole bunch of workplace relations stuff, as you've started to see. There's also stuff on health and safety, and in the mix in there is sick leave and stuff. Yep.
And the possibility of that went straight into News Talk ZB's news bulletins. But when the Prime Minister subsequently appeared on the Herald's new live streaming show Herald Now, the host Ryan Bridge didn't mention it, concluding instead with this.
Before you leave, actually, Chris Bishop's apparently doing a yoga session at Parliament. Are you aware of this?
That's a frightening thought, actually.
I thought
Chris
so
Bishop
too.
in Lycra doing yoga is not something I really wanted that mental image.
He's hosting the session, apparently.
But when the Prime Minister did his turn on RNZ's Morning Report soon after that, they did slip in a quick question about sick leave at the end.
Are you proposing or moving to reduce the number of sick days from 10 to 5?
Look, that's something that I know Brooke Van Velden is looking into as she looks at a whole raft of workplace relations. So it's a bit premature for now. But
would you support that?
Well, I think there's probably a need for us to look at it for sure and just make sure that we've got that setting right.
The Labour Party's subsequent statement cited that on RNZ to raise the alarm, though, as we heard, it was Mike Hosking's cable guy, apparently, who was the spark of the story, and one of interest well outside the Beltway, as ZB's political editor Jason Walls made plain soon after.
Sick leave, it's an entitlement that everybody has. So it's not just some Beltway story. It's something that's actually going to touch a lot of people. But it is an interesting thing for the Prime Minister to bring up. It's not like it was a big news story. It was just Mike's mate that was talking about it.
But it wasn't just Mike's mate, the tech guy. Mike's mates behind the mic at News Talk ZB were also teed up to talk about sick leave entitlements all day.
So there you go. A very strong hint that 10 days of sick leave might be going the way of the dodo.
Now, Way of the Dodo sounds a bit like a disappointing Bruce Lee martial arts movie, but Kerry Woodham's take on sick leave was this.
I get that it's a godsend if you are prone to infections during winter, but really spare a thought for the employers.
Employers such as, perhaps, Nick Mills, a hospo guy in the capital who's also the host of the Wellington Morning Show on News Talk ZB, who at that very moment was telling his listeners in the capital this.
I go with the flow. If it's 10 days, it's 10 days, and if it's 5 days, it's 5 days. I've not, got a clear idea on it. But I'm in an industry where people take the absolute mickey.
Nick Mills also reckoned we might be getting softened up for change across the board.
They're just teasing it a bit at the moment on the fact that it's going to be for only part-time employees, but that's going to change.
At the same time of the day, the ZB listeners in Canterbury get the local Canterbury Morning Show, and 1 hour later, they were hearing this from the host John McDonald on Monday.
I want to talk about sick leave because the Prime Minister was talking to Mike this morning and Mike quizzed him about sick leave and said, are we going to stick with 10 days or are we going to put it back to 5?
And when Matt Heath and Tyler Adams took the ZB mic back for the full national ZB network at noon, they had a similar sense of what was common sense.
10 days a year sick. I can't even imagine being that sick.
What I thought 5 days, which is technically 7 days, that's a good time to get over unless it's something really serious.
If you've got a serious illness, I totally understand, and we need to sort those people out and help them best we can.
Yeah.
But just the average person walking around needing 10 sick days a year, I don't think so.
No.
And after all that, the questions for the minister in the hot seat on this, Brooke Van Velden, were still coming in on 3 News at 6 p.m. on Monday, sometimes at the same time as her answers.
This has actually got nothing to do with gender. It's to do with what is right. If you're a man or a woman
it does have to do with gender, because we know that women are more likely to be in those part-time or casual roles.
Well, the question there was whether this, like the pay equity reversal last month, would hit female workers hardest. But Brooke Van Velden also rejected that on RNZ's Checkpoint about an hour earlier, where she was taken aback that this was a talk radio talking point at all.
At this stage, I'm hoping to progress with a Holidays Act replacement to go through select committee where people could have their say. But at this point in time, we're not at that stage. The only reason we're talking about this is because Mike Hosking was talking about it this morning. There was nothing from the government side to say we had an announcement to make.
So in the end, it will be months before all this is fully aired in Parliament, long after Mike Hosking's tech tradie first put it on the agenda. But what of the other health claims that Mike Hosking put out there the same day? A 4 p.m. weekday deadline to complete elective surgeries in public hospitals. When Health Minister Simeon Brown appeared on the Mike Hosking breakfast the following day, Mike Hosking asked him this.
He claims if things look like they might be going past 4 o'clock, it starts to close down a bit. Is that true?
Well, look, there is heavily unionised contractual arrangements in the public system, and so yes, you do end up with inefficiencies throughout the system, and those issues need to be dealt with by Health New Zealand to make sure that it is more efficient.
And Mike Hosking responded to the apparent confirmation of that 4 p.m. deadline this way.
Oh, this is going to go to past 4 o'clock. Let's not do it today. What's that about?
You put those questions to the senior doctors union when they're next on your show, because ultimately these are union agreements which have been negotiated over a long period of time, which drive inefficiency and a lack of productivity.
With Health New Zealand, though.
With Health New Zealand, I agree, and these are issues that do need to be resolved as part of those negotiations with the unions.
So Mike Hosking signed off with the Health Minister like this.
All right, appreciate your time as always. Health Minister Simeon Brown this morning. It's disappointing to find out that's true.
But was it actually true? I asked Sarah Dalton of the Association of Salaried Medical Specialists.
Absolutely not correct. The reason that there are limits on elective surgeries in public hospitals is more about management decisions, about staffing costs, about availability of recovery beds, and decisions about how to distribute operating theatres between acute and elective work.
Is it true, though, that in almost every circumstance, no elective surgery can take place after 4 p.m. and that weekdays 8 till 4, that's it for elective surgery in public hospitals?
I'm not sure that those are the specific hours in terms of 8 till 4, but typically surgeons and anaesthetists work 10-hour days. Again, the reasons for limiting the use of elective theatres for elective surgeries is more about the cost of paying staff in the evening. So there are absolutely arrangements made in a number of hospitals at some times to run what are sometimes called twilight theatres because they happen in the early evening or on weekends.
Yeah, I read after COVID, particularly in Northland, they had a very long waiting list and they were doing exactly that, weekend surgeries. But that was reported as a very uncommon thing. So, yeah, can we take it that what was actually said on News Talk ZB was actually right, and in most instances there won't and can't be in public hospitals, operations done post around about 4 p.m.
I think elective surgeries, that probably is the norm, but of course there is acute operating done at any hour of the day or night, and again, this notion that public hospitals are less efficient, acute surgeries always take priority in public hospitals at any time, and sometimes elective surgeries have to be cancelled because the acute demand is greater. There is lots of time spent by managers trying to work out how to maximise use of their operating theatres. But again, typically it's staffing shortages that get in the way of maximising use of operating theatres or lack of staffed hospital beds, which again is a resourcing issue. So I don't think the way that discussion has been presented is entirely fair, and it is somewhat misleading.
What about there was also a claim read out on the air on ZB just from someone texting in, I think, that said it's really about the nurses and anaesthetists, that after the turnaround after a first operation, kind of slow things down such that if a major operation can't get underway on time, does that happen?
My knowledge of particularly anaesthetists and surgeons is they definitely don't want to slow things down. They want to churn through as much operating as they realistically can. But again, you have to take note that there are a range of occupational groups that are required to run operating theatres, from cleaners, from the people who run sterilising services, clinical staff that you're likely to see in the operating theatre. All of those have to have safe and sustainable working days and working hours, because the work that they're doing is really critical and patient safety has to be paramount. So while some staff will happily work longer days, there also have to be checks and balances in place to make sure that that's safe. I think there needs to be a better informed debate, because there is no doubt that it costs more for people to be seen in private. The cheapest way to ensure people are seen is to make sure our public system is running in a way that's properly resourced. So that's staffing, that's theatres, it's bed capacity, all of those things. We have seen really disappointing instances where offers to run more elective surgeries, for example, gynecology cases in Whangarei, management refused to pay nurses overtime to run twilight theatres or weekend theatres, and then chose to send those patients out of Whangarei to Auckland to have private operations, which would have been much more expensive and much less efficient. It is concerning to us that private is seen as the answer when in fact they are already near capacity of what they can do. And I think anyone who thinks just directing patients to the private sector and that's going to sort everything out. And we also have significant doctor shortages, which is going to put further pressure on our public system. And there are many, many surgeries that cannot be provided in private.
But if the Minister says current arrangements with doctors' unions are a roadblock to doing more surgeries in a wider range of hours, elective surgeries, and that needs to be renegotiated with Health New Zealand, if it's true that under current arrangements they can't do it, wouldn't that help?
It's not true. It's not true. The doctors' unions are not a barrier to providing more elective surgeries in hospitals. The barrier to providing more elective surgeries are a refusal of management to pay all staff required to work longer hours, and that's I'm not talking about the doctors here, an inability to provide sufficient staff to run our operating theatres to their maximum capacity. Our members in our union, we don't have anything in place that would stand in the way of doctors opting to work in a different work pattern or longer hours, and in fact many of them frequently do.
That was Sarah Dalton, the Executive Director of the Association of Salaried Medical Specialists, talking to me there last Wednesday. Now, the next day on News Talk ZB, Mike Hosking returned to the issue on his show with, this time, Health New Zealand's Chief Clinical Officer, Dr. Richard Sullivan. Now, he said that the proportion of early finishers in theatres doing elective surgeries is declining, but there's still room for improvement, he added. And under the government's elective boost program to cut the longest waiting lists, they had been doing some surgeries on Saturdays and Sundays too, he said, but not many, prompting Mike Hosking to ask him this.
Could you do it if you really wanted to, or are you constrained by the unions and the collective?
It's workforce, hey, so it's more than just the unions. So you need quite a big workforce to run full Saturday lists all the time. Now, that's not to say that's not something we shouldn't look at. But we need to look at the most efficient way of getting people through our theatres. These metrics have been super helpful. So we measure, what we call the utilisation. So how well we use our youth theatres. Our benchmark's 85%. We're tracking at 81.3. So we could do better there. We look at our start and finish times, which is this conversation.
A useful answer there, leaving Mike Hosking with this conclusion.
He basically confirmed everything that was said on this program, and that is, if it's past 4 o'clock, don't worry about it, we're going home.
But there is a bit more to it than that. There is extra capacity in public hospital theatres, but many more people would have to be paid for many more hours to do more out of business hours surgeries. And it seems we don't have all the staff we might need to do a lot more of it anyway, in public or private hospitals. And another question, is there money in the health budget to cover it? Either way. And that brings us back to what the Herald's Thomas Coughlin had reported earlier in the week. Treasury saying the health delivery plan targets could mean spending cut targets in health would have to double in the coming year to meet them, while health workforce pay increases would be limited to a degree that the Treasury described as unprecedented. Now, Simeon Brown has rejected Treasury's conclusions strongly, saying that government had provided Health New Zealand with additional funding in 3 successive budgets and that Treasury hadn't consulted the Ministry of Health or Health New Zealand before briefing the Finance Minister. But what is clear is that it's not just a matter of public hospital theatres and staff lying idle after hours because that's what their unions have wanted, and the cost of maximising what we do have for elective surgery in both public and private hospitals will come at a cost elsewhere in the health system. This week in Parliament, it was Scrutiny Week, in which parliamentary committees quizzed government ministers, and last Wednesday the Media and Communications Minister Paul Goldsmith got a relatively rough ride at times about what he had achieved in the role and what he hadn't.
It's been over a year since you were made Minister of Broadcasting and almost a year since you issued a media release stating that you were going to take immediate action for the sector. How slowly do you need to move before it's not immediate?
Well, I think you'll find, and thank you for that historical outlook, we've made some good progress in some areas.
Paul Goldsmith told Green MP Reuben Davidson and the rest of the committee he did have a media regulation reform package ready to roll, including a green light for on-air ads on Sunday mornings and rules to make streamers like Netflix and Disney make more local content here.
And of course, one thing we won't be doing is wasting another $20 million on a failed merger between RNZ and TVNZ that went nowhere. And so, yes, we've got a bit of ground to cover, but we're doing our best.
Though one move that has been made, and was also aired at the committee last Wednesday, was the 7% cut in funding for RNZ in the budget last month.
Yes, I had a choice. I could find savings through New Zealand On Air's funding, and I didn't want to do that because that's money going out the door to people. And so, and I heard had big increases in funding over the past few years. A lot of areas across the arts and media space have had rather static funding over a long period of time. But RNZ stood out, and so we thought that they could make some savings, and I think they can.
So media outlets can perform better with less funding, is what you're suggesting?
Well, I think you'll find that there's people doing that every day.
At the time of the budget, the minister said, "I expect RNZ to improve audience reach, trust and transparency. I'm confident the organisation can do so in a period of tightened fiscal constraint." And this week, RNZ told staff it was opening a voluntary redundancy scheme as part of its plan to run on reduced income. This week, we wanted to talk to RNZ's Chief Executive Paul Thompson about what all this might mean for RNZ services, for listeners and users, as well as the staff. But that was declined because they say it wouldn't be appropriate while the voluntary redundancy scheme remains open. But we will come back to that here on Media Watch when we can. Now, at Parliament on Wednesday, the Select Committee also asked the Minister, Paul Goldsmith, about that development and also about hundreds of jobs in journalism that have been lost at commercial broadcasters in the past 12 months. Now, he said that wasn't really something he was directly responsible for.
I mean, that is a kind of a ridiculous notion, as if the Minister of Media is somehow directly responsible for a chunk of the economy, which is based on a whole bunch of other things. And on
an approximate number?
Well, there's been a lot of job losses, particularly in TVNZ, and I don't have the number in front of me right now. We can give you to it if you want. And it has been a challenging time. Of course, it's been a very difficult time with the closure of News Hub and presses right across the board, and I think that's well acknowledged and well established.
But he did note that one news company, Stuff, has secured significant backing lately.
I would note that in the recent weeks we've seen some investment in one major entity in Stuff, which is good, and it shows that people are continuing to invest in the New Zealand media.
When Stuff agreed to sell half its digital wing to Trade Me earlier this month, Stuff's owner and chief executive Sinead Boucher said that the first sign of change would be Stuff's property and housing content rebadged as Trade Me property. And I asked her, does that mean we should expect more stuff in Stuff publications about stuff for sale on Trade Me?
I don't know why on earth anyone would think that. We've made it really clear, and as is Trade Me, that they are completely hands-off in relation to any content, any involvement in the day-to-day running of the business, and especially in anything to do with the editorial.
And we haven't seen anything like that on the Stuff website or in its papers, which are now part of a separate business called Stuff Mastheads. But Stuff also produces 3 News for the TV channel 3 each night at 6 p.m. And last Monday, it featured this.
Tomorrow marks 20 years of Trade Me property. Since 2005, the site's listed everything from first homes to private islands. Imogen Wells takes a look all the way back to the first listing, a home in Mission Bay. And you won't believe what it was going for.
And Trade Me's own property boss, Alan Clark, then appeared on 3 News to compare it to the soaring price of butter. And there was more where that came from him.
And over the last 2 decades, there's been plenty of so-called property porn to enjoy.
The most popular is actually still up there. It's got almost 750,000 views. It's your own private island in the Cook Islands. I think stuff of absolute dreams.
It wasn't just Trade Me people in this 3 News report by Stuff, saying stuff like that about stuff that few of us could afford a fraction of, but they were all talking about Trade Me property, and in glowing terms.
Michael Bulgaris says Trade Me's entry into the market 20 years ago was a game changer.
2.5 weeks ago we listed a property, 61,000 hits, Trade Me, in 2 weeks. Now that's just astronomical, isn't it?
Adding that the search function is a buyer's best friend.
Well, astronomical maybe, but was it news? Well, must be, according to what Stuff owner Sinead Boucher told me the day after they did that deal with Trade Me about any Stuff stories we might see about their new partner from here on in.
You can be sure that if you do see any of those stories, it's because our editors have independently judged them as newsworthy and it's streamed to our audience, not because of our ownership.
Well, OK, but when Media Watch had a little look around at the news this past week, it seems no other editors have yet seen a story to be told in Trade Me marking 20 years of promoting property for sale online. Last weekend here on Media Watch, we looked at how local elections are coming up later in the year, and we opened the show with this.
A survey commissioned by Queenstown Lakes District Council has found support for the Mayor and councillors has dropped to 17%. That's down from 44% last year. The results of the survey of about 400 residents by Key Research shows frustration over infrastructure, traffic and tourism pressure.
Tough news there from RNZ News for councillors wanting to be re-elected in the region, we reckoned.
Just 17% of respondents felt the council makes decisions in the district's best interest.
Now, that survey was conducted back in March, and we said it was in the news now after the local online news outlet Crux reported last week that it had appealed to the Office of the Ombudsman for the release of those results. But the Queenstown Lakes District Council has been in touch since then to say publishing the survey results was a standard part of our process and commitment to transparency, and the full 2-part survey results were released on the 11th of June. Crux also reported last week, and we repeated it on Media Watch last weekend, that some of the council's survey results, which would have further lowered results for trust, had been excluded. But the Queenstown Lakes District Council pointed out that survey from Key Research was in 2 parts, an invite-only one sent randomly to more than 3,000 residents of the region, which 450 people responded to. And there was also a second part, a self-selecting survey, which any adult resident could complete online. And 355 people did that. The published survey says those results aren't included with the others, and this was outlined in a media release at the time, and indeed it's at the end of the report that was published online on June the 11th. The report says results from self-selecting surveys are often more negative than those gathered through a managed, scientific and representative approach, and inclusion in core reporting is not considered best practice in this type of research. And you can see the results and the method for yourself at qldc.govt.nz in the news section of the website. On Midweek Media Watch last Wednesday, our weekly catch-up with Emile Donovan on nights on RNZ National, Hayden Donnell took a look at talk radio hosts flip-flopping on their hot takes on the economy and how digital communication technology makes it possible for modern media to rustle up on-air interviews with almost anyone, anytime, at almost no cost, until it doesn't.
Paul Buchanan is a former intelligence and defence policy analyst and consultant to the US government. He's with us this morning. Paul, good morning. Paul, what is the risk of this? Yes, I can hear you, Paul. It sounds like the line is a little dodgy.
Well, can happen to anyone on the air these days. And on the subject of digital tech not quite working as it's meant to, next weekend here on Media Watch, artificial intelligence apps caught out lying to journalists.
It's saying things are getting better, but the data suggests the opposite.
And the technology has also been making stuff up and even apologising for that, sort of.
And finally, AI confesses. Look at this.
Meanwhile, a skeptic here has found that Google's AI dodges deep questions.
The skeptical, the rational, the scientific answer was the answer that Google's AI just refused to give.
And in both cases, it seems like AI is trying to tell us what we want to hear. But if so, does that make it a bit more human after all? And do the media need to be extra wary? We'll look at all that next weekend here on Media Watch. For now, though, that's it for this weekend. Thanks for listening. If you have any thoughts for us or ideas for us to follow up, do get in touch. Email us, mediawatch@rnz.co.nz, or you'll also find us at MediaWatchNZ on X. And you can even write us a letter and send it to Media Watch, PO Box 123, Wellington. I'll be back next Wednesday with Midweek Media Watch. Catch you then. In the meantime, follow Media Watch and listen on Apple Podcasts, Spotify, or any podcast app to make sure you never miss an episode.